Hi, everybody. I'm Susannah, she, her, pelvic physiotherapist with Core Connection. And I wanted to talk today about chest construction, the benefits of preparing, and what rehab can look like afterwards to really promote you thriving in your body before and after surgery. So there's my contact information. You can find me on Instagram, and you can also find me on my website. So, our topics today, we're going to talk about preparation before surgery, recovery right after surgery, and then how to thrive after that. Preparation. So, some of the benefits of preparing for surgery is to go in with a stronger body, to recover more easily, to practice for post op. Some of the exercises and techniques will be the same before and after, and to improve blood flow and circulation in your body. So, nervous system preparation is something that you can start doing about 5 minutes per day. And that's to really help turn the dial down on your nervous system in preparation for surgery. So, it can help settle anxiety, it can reduce pain, and it can help ease your recovery. Here are some different ways you can consider preparing your nervous system: meditation, breath work, which we will talk about a little bit, yoga, trauma therapy, connections with family and friends. Prayer is another one for some people, and journaling about things that you're grateful for. Not all of these will be accessible to everyone, and it'll be perhaps some trial and error to find what works best for you. So, a little bit about your core. So, the top muscles in the core canister are your diaphragm. Then, the middle, you have your transversus abdominis. So, that's your deepest core muscle, your deepest abdominal muscle that goes around, all the way around like a corset. You have the multifidus supporting your back, and then you have your pelvic floor muscles at the bottom of that canister. And so, one of the things you can practice before top surgery or chest reconstruction or chest construction surgery is your breath. And that can be super helpful to help regulate your nervous system, but also to help increase range of motion around the rib cage and around the chest. So, one way you can practice this is wrapping your hands around your rib cage. Inhale into your lats or inhale into your side ribs for as long as you can, and then exhale, allowing the ribs to sink in and down. So as you inhale, they come up and out. As you exhale, they come down and in. So focusing on your breath, especially long inhales, can help increase oxygen in your body, blood flow, support relaxation, improve the mobility of your rib cage, which is something we really want to focus on post-op as well, and prevent stiffness in the rib cage. Belly breath is another way you can practice, and if it doesn't feel good in your body or if it feels agitating, and that goes for any of the recommendations, then it's probably not for you. So this one, you can place your hands on your belly, inhale as if you're breathing into a balloon, see if you can breathe in for about 7 seconds, and then exhale really passively, just imagine the balloon deflating. So one of the things I love to recommend is daily movement snacks, and that's just a way to nourish your body as you prepare for surgery. So 5 or 10 minutes per day is great, and you can even sprinkle them throughout your day if it works in your schedule. So the first focus would be flexibility. So that's maintaining range of motion wherever possible. And when it comes to this surgery, we're thinking a lot about maintaining mobility in the shoulders, in the chest, in the upper back, and in your neck. Those are common areas that might get stiff after surgery. Second type of movement snack would be strengthening. And Ideally, we want to aim for about 3 times a week, 10 to 30 minutes for each session. So one type of strengthening is using your body weight. So you can do variations of push-ups. You can do pull-up variations, maybe with assistance to start with. Tricep dips is another one you can do on a chair or on a couch. And starting out where you're at and then progressing over time as you build strength. So resistance strengthening is with weights or sometimes with bands. And so you can practice chest press, pull downs, pull backs. So that's when you're either leaning over and pulling your elbow back behind you or sitting up and kind of doing a row type of pull. And then overhead press is when you're pressing something up over your head. And there's always ways to modify these to start at the level that you're at. So core strengthening, some examples are dead bug. So that's lying on your back with your arms out in front of you and your knees bent. Superman, which is the one that's pictured here, and plank variations. So starting with more easy variations and then building to more difficult. So after surgery, some things to think about. So physiotherapists are trained rehab professionals. And so one of our roles is to help people after surgery increase their flexibility, increase their mobility, increase their strength, work towards their goals, whatever those might be for different types of activities, and prevent any complications that might come from surgery. So preventing scar tightness, promoting freedom of movement, ensuring that you're getting really good full deep breaths, helping you figure out a good balance between rest and effort. Sometimes people do too much too soon after surgery. Sometimes people are not doing enough. So finding that sweet spot can be really helpful. And just supporting you in getting to know your new body post-op. So one thing you can start with post-op is your breath, and there's a few reasons for that. One is preventing any complications in your lungs. Another one is helping to start to increase that rib mobility again and promoting relaxation. So some movements to avoid is reaching up overhead and extending your arms behind you. Pain management is going to be really important because if we're in a lot of pain, we might not move as well and we might not breathe as well. So we want to make sure we're staying on top of the pain, especially in the first days and or weeks post-op. So take the medications that are prescribed, report any side effects that you have to your team. They may need to tweak the medication that you're taking if you're having side effects. And if you're taking opioids, then it's important to prevent constipation. So some people will take a stool softener with the opioids. So taking a stool softener every day can be one way to prevent constipation from happening. Some other ideas to support happy poops. One is using a squatty potty, so a stool that wraps around the base of your toilet that elevates your knees above your hips. That can help relax your pelvic floor and help make pooping easier, making sure you're getting enough fiber and water. Working on pelvic floor muscle flexibility if needed. And psyllium husk is another great option for getting a natural fiber. It doesn't work for everybody, but for some people it really helps ease the bowel movements. So physiotherapy can help. Post-operatively, we can help treat pain. We can help improve the mobility of your scars. We can coach return to exercise, and we can address any pelvic floor issues. So as I was showing earlier, the diaphragm is the top of the core, the pelvic floor is the bottom of the core. When surgery is happening around the chest, then that can impact the diaphragm and the pelvic floor muscles. So some early core exercises you can do is practicing inhaling fully like a balloon and then exhaling, drawing your belly button in and up. So that can be done in a variety of different positions. And that's to activate that deep layer of abdominal muscles that I showed you earlier. Scar massage is something you can do on your own. Often physiotherapists will teach you how to do that. So approximately 1 month post-op, starting with light touch and then over time increasing the amount of pressure that you use on the scar. So you can go across your scar and you can go along your scar. A lot of people will use either a vitamin E oil or a bio oil to help soften the scar tissue. We want to make sure that scar tissue moves well so that it's not causing you any discomfort when you're moving your arms, when you're taking deep breaths, when you're bending forward, when you're extending backward. And we want to make sure that the muscles around that area are able to work well as well. So, thriving post-op. So when we think about exercise, we're thinking about a balance, if we can, between cardio, strengthening, and flexibility. Here are some resources. Transcare BC has a great website, and they have great peer advocates that you can connect with one-on-one. And as well, community peer support has some great groups. So if you have questions, please feel free to reach out by email. I'm happy to answer any questions. And I really love supporting people pre and post-op gender affirming surgery. So let me know if any questions come up.